Welcome to today's session of our health discussions. Yes, so we'll be talking about vaginal infections. Vaginal infections. So, is it every vaginal discharge that indicates that there is an infection or what? So, let us look at it. Some of the indications that may point to the fact that one has vaginal infection. So, first, when the vaginal discharge is associated with offensive smell, when the vaginal discharge is associated with offensive smell, then it might show that there is an infection. Then, secondly, if the discharge soils the woman's undergarment, that is, the discharge soils the lady's underwear, that might show that there is an infection. Then, the third point is that if the discharge is associated with itches of the private part, that might show or indicate that there is an infection. Then the fourth point is that if the discharge is associated with pain, lower abdominal pain, then it might also indicate that there is an infection. Then the fifth point is that if the discharge is associated with pain during urination, if the discharge is associated with pain during urination, it might also indicate that there is an infection. Then the sixth point is that if the discharge is also associated with pain during sex, which the medical people call dyspareunia, so if there is dyspareunia, it can also indicate that there might be an infection. Yes. So the seventh point is that if the discharge has no consistency, one time it is thin, another time it is thick, one time it is this, and another time it is that, it means that it's likely to be an infection. Then the eighth point is that if the color changes, possibly you realize that usually you have white vaginal discharge or some mildly gray vaginal discharge. It's not gray, but it's just like white discharge, and you know that that is your normal vaginal discharge. Then at a point in time you realize that it is green, it is yellow, it is stained with blood, then you suspect that you might have vaginal infections. So these are some of the indications of vaginal infections. Do not have your normal or physiological discharge and then go for antibiotics thinking you have vaginal discharge. So let's stop the abuse of antibiotics. Yes. So in my next video, I'll be talking about physiological vaginal discharge, so that you know that some treatment we give to ourselves, we really don't need to do so. Stay tuned for more. I'm your online health coach, Clem.